Good morning, everyone, and welcome back from Doug Ford's endless summer vacation. And while the Premier had an extra long break, I've been traveling across the province to listen to the stories of real Ontarians. And here's what they're concerned about: healthcare, healthcare, and healthcare. Of course, I know you've been working hard for the last 5 months too. Just like everyday people in Ontario are working hard each and every day. And let me be clear, the hardworking people of this province are doing everything right. But with Doug Ford as Premier, it's not paying off as it should be, and it never will. He's had 6 years to fix this, and he's only made things worse. Because Doug Ford's priorities are not your priorities. His only priority is to create opportunity for a very small handful of rich friends and conservative insiders. And all that effort and the tax dollars you are putting into this province end up going to them. $1 billion to 7-Elevens, grocery giants, and beer companies to put booze in local stores 1 year early. Or $2 billion to a foreign spa company in the worst ever negotiated deal in Ontario's history. Meanwhile, we have a crisis in our healthcare system. More than 2.5 million Ontario residents don't have access to a family doctor. Families waiting hours for treatment. Wait times have increased 48% since Doug Ford became Premier. People, 11,000 of them, who have lost loved ones just waiting for life-saving treatments, and 11,000 more waiting for opioid treatment. Hearing from those lucky enough to actually receive treatment are actually in hallways, stairwells, and the entrances to hospital buildings. 2,000 people are treated in a hallway each and every day. What happened to eliminating hallway healthcare, Doug? This is not right, and this is not what healthcare should look like in Ontario. So our job is to use every day to drag your priorities to the attention of this Premier, because clearly he's ignoring healthcare. Our job is to tell your stories and to force Doug Ford to face his failures. You don't need a government that puts profits over patients. You need someone who delivers more for you. And now I'm going to hand it over to Dr. Adil Shamji and to John Fraser to make some comments. Adil?
Good morning, everyone.
Mention Ted's here.
I'm thrilled to be joined by our leader, Bonnie Crombie, MPP John Fraser, and MPP Ted Chu from Kingston and the Islands. Thank you for joining us. To call the performance of our healthcare system lackluster might be the understatement of the century. Last week, the Ontario Medical Association called it a catastrophe. And certainly the ministry's own data reveals that our healthcare system is the worst that it has ever been in our province's history. We're supposed to have an election in 2026, but Doug Ford wants to move it up to next year, because in 2026, 1 in 3 Ontarians won't have a family doctor, and so they won't vote for him. He knows 2.5 million Ontarians don't have one right now, so he's trying to beg their forgiveness with $200 giveaways. He wants to rile people up about booze and bike lanes because he doesn't want them riled up about not having a family doctor. And he wants you to think that if you can get a UTI treated by a pharmacist, then that is good enough, that you've got primary care. Today we're here to say don't settle for less, because we're not willing to. In the midst of the scarcity that Doug Ford has created, he's conditioning us, he's training us to settle for less. And my message to Ontarians is to dream big and demand more. You deserve a family doctor. You deserve a team of healthcare workers that includes nurse practitioners, social workers, nurses, and so many more, whose sole purpose is to be there for you when you're sick. and make you the best version of yourself when you're not. And accessing this should be no harder than figuring out what school your child is going to. Doing this takes investment, it takes intention, and it takes ingenuity. Doug Ford has none of those things, and Ontario's Liberals do. So this is what we will be fighting for. And this is what Doug Ford is forsaking. And by forsaking primary care and family doctors, he is forsaking the future of our province, because we can't build homes without healthy workers. We can't grow food without healthy farmers, and we can't build highways without healthy road builders. In 2026, if 1 in 3 of us don't have a family doctor, all of these things will be at stake, and we are not going to let that happen. John.
Thanks, Adil. Thanks very much, Adil. And I want you to imagine right now that in the city of Ottawa, the second largest city in Ontario, no one had a family doctor. And in the third largest city in Ontario, Mississauga, the same thing was true. And in the fourth largest city, Brampton, no one had access to a family doctor or a nurse practitioner. That's the size of this problem. Just imagine that. The reason that we call it primary care is it comes first. If you don't have a doctor, access to things like simple treatment for UTI infection, a referral, just basic guidance on how to stay healthy. You know, you don't get that. It's harder for you. It's even harder when you have a chronic disease like diabetes or asthma to get what you need to navigate the system, or you're old, or you're frail. And it's even harder if you have a cancer diagnosis or heart disease. It's a big problem. It needs to come first. And it's not coming first with this government. And that's wrong. Now, I'm sure the government's going to have something to say, have some big news announcement, they'll announce some money. The reality is, Doug Ford took his eye off the ball, and he's done that for almost 6.5 years. And now, because he wants to have an election, he's going to say, I'm going to do all this stuff. Don't believe him. Don't believe him. What we need to see from this government is not process, is not a panel, is not millions of dollars. We need to see outcomes. Where are we going to go? Because if we don't know where we're going to go, here's what's going to happen. What I said to you about imagining no one having a family doctor in those 3 cities, well, you can add Hamilton, you can add London, and you can add Markham and Vaughan in 2026. That's just wrong. Doug Ford took his eye off the ball. And you know what? He shouldn't be talking about digging tunnels, because he's done enough digging, dug a deep enough hole for healthcare in this province. Thank you.
We're happy to take your questions. Good morning.
For Adil.
Sure.
We got the Hamilton Spectator had two stories over the weekend about a very large shortage in medical supplies for home care.
Yeah.
Apparently, the transition from like the old Lynn suppliers to the Ontario Health at Home suppliers has been going very badly, and people are home care nurses can't get supplies. I did talk to some people myself, and it's also happening in York Region. It's not just in the Hamilton area. This new centralized agency was the PC's idea. Do you think this? What do you make of what is happening in home care at the moment?
I'll begin by answering, and I know John Fraser has a lot to say on this as well. What we're seeing, not just in Hamilton, but across the province, in terms of healthcare, in terms of home care specifically, is not a surprise. This centralized home care agency, Ontario Health at Home, was born by legislation called Bill 135, arguably one of the worst pieces of legislation I'd ever seen. We were highly critical of it from the beginning. It left out all of the details and could not offer a single concrete way in which it would improve home care in Ontario. I warned the government, we warned the government, and now they are bearing the fruits of their labor. People who are dying at home, who are suffering after catastrophic illnesses, deserve our compassion, our service, our healthcare system. And Doug Ford, through his mismanagement and deliberate underfunding, is denying them their dignity and the care that they deserve. John, do you want to say something?
Yeah, I don't want to say much more. I do touch on palliative care. So when someone's at home and they're dying, those supplies, they're critical. My mom died at home. I was with her for the last 2 weeks. And if she didn't have a pain pump or access to opioids or access to medication that would stop her from choking or gagging, it would have been a pretty awful end. That's what's happening to people. That's what's happening to people. And it's because the government made a change and they didn't think it through because they thought it was a good idea. And a whole bunch of people are caught in the middle. And a whole bunch of people who are at the end of their lives. That's just wrong. That is so wrong. And the government needs to get on this. I don't know how they're going to fix it. But it should be all hands on deck because there are people suffering at home because they don't have access to pain medication or pain pumps or wound care. Come on, folks.
Bonnie, fall sitting, you guys are talking about healthcare today. Is that your party's priorities or what are the priorities for the fall sitting?
Actually, those are the priorities of the people of Ontario. That's what I heard traveling across the province. People are concerned that 2.5 million people don't have access to a family doctor. John has told you what 2.5 million people look like. That's twice the region of Peel. By 2026, it'll be 4.4 million. So you add in the next top 4 cities John outlined. 4.4 million people don't have access to a family doctor. 11,000 people died, passed away, waiting for surgery or care. 2,000 people each and every day get treated in a hallway or an entrance. Wait times have gone up 48% in the 6 years that Doug Ford has been premier. Oh boy, did he take his eye off the ball, as John has told you. This is a government that governs by gimmicks and distractions and isn't focused on the priorities of real Ontario families. And the Ontario Liberal Party is, yes, healthcare is the #1 issue that Ontarians are concerned about. Yes, they're also concerned about overcrowded classrooms and the lack of affordability, the inability to buy a house or afford their rent. But above all, they're worried about healthcare first, and then the lack of affordability. Anyone else like to comment about this? You're okay. Okay. Thank you.
What would your party do to increase the number of family doctors?
Well, we've got, take a look at our platform. We were on record. We certainly need to recruit more family doctors. We need more medical spaces in medical schools. And we're looking at foreign doctors. And we need more nurses. Above all, we need 33,000 nurses. Stat. That'll help address the system. You know, this is the expert right here. Why don't we let Adil talk about how we attract more doctors, family doctors, and nurses. But we want to focus on primary care teams.
Well, the #1 thing to take home is that a high-quality healthcare system that is founded on primary care, on family doctors, requires investment. A paltry $100 million in primary care, as was announced earlier this year, is not going to cut the mustard. How is it that this government is okay spending $1 billion to bring booze into convenience stores 1 year early? Over $3 billion to send out novelty checks? How is it that they're willing to commit to over $100 billion to build a fairy tale tunnel under the 401?
$2 billion spa.
$2 billion, thank you, $2.1 billion on a mega spa, mega scam. But they can't come up with the money that's necessary for primary care. The money needs to come first, and this government is skimping Ontarians. After we've got that in place, of course, we need medical school places. We need to reduce administrative burden for family doctors. We've got to establish teams of primary care. There's so much that can be done, but they require investment. And this is not something that the government is interested in doing.
John, do you want to add anything?
Yeah, I'll just add on to what Adil said. You know, it's investment. You know, we have nurse practitioners in this province who are having to hang out a shingle because OHIP doesn't cover them. They're an important part of the team. You know, they're an important part of access to the kind of care that people need. You know, this whole thing of primary care, it's not notional. It's like if you have asthma, you need a primary care physician. If you have diabetes, you need one. If you're aging, you need one. If you're at risk for heart disease, you need one. If you're at risk for cancer, you need one. And if you don't have one, I'm going to say you're screwed. And I don't say that lightly. Like, how do you get to where you need to get to if there's not somebody to help you? You go to the emergency room. No wonder our emergency rooms are a mess.
Bonnie, what do you think about the Premier this morning appointing Dr. Jane Philpott as the new Primary Care Action Team Chair? She was, of course, the keynote speaker at your convention
Yes, she was.
in London. And I gathered that you guys liked what she had to say. Presumably the Premier also likes what she has to say. Isn't this a good sign for primary care reform?
Listen, I have a lot of respect for Dr. Jane Philpott. I think she is an authority on primary care teams. But yet again, we see this government appointing an expert or a panel of experts only to write a report, which they will ignore. Adelaide, I know you wanted to talk about this too.
Thank you. I genuinely wish Dr. Philpott the best. I would like to point out she already chairs Doug Ford's task force on internationally trained physicians. And since she's taken that position on Doug Ford's task force, there has been zero progress on internationally trained doctors. This is a government that has a track record of appointing experts, asking for reports, and delivering nothing. Call it the Housing Affordability Task Force. Call it the Long-Term Care Inquiry. It's one thing after another after another. They do not listen to the people that they appoint. They've done that with multiple reports. They've done that with Dr. Philpott. And I'm deeply concerned they're going to do that again. Why have they waited 6 years to try and make it look as though they're going to take any meaningful action?
I think John wants to say something.
Oh, I was going to hold my own there for a second. It's just, it's almost like 6.5 years, almost 7 years. The Premier took his eye off the ball. And now, because he wants to have an election in the spring, hey, let's get a commission together. Well, what are the outcomes? Like, what are we trying to achieve? Like, you know, maybe they'll announce millions of dollars, but if you look at long-term care, you look at housing, every time they appoint someone to write them a report, they say, thank you very much, they take it in, and maybe they share it with us, but they don't do anything.
No, it collects dust.
They don't do anything. So this government is great at telling a story.
So Bonnie, if you become Premier after the election that may come in March or April, would you adopt the recommendations of Dr. Philpott?
Yes, absolutely. Dr. Philpott and I have had that conversation. We're eager to proceed with her recommendations, not write a report which will gather dust and sit on a shelf. I'd like to invite Ted, because he let me know that he'd like to make comments on this issue as well.
Oh, yeah, of course.
Thank you. I'm very worried that this is going to be the kind of window dressing that John Fraser talked about. Jane Philpott is a constituent of mine. She lives in the West End of Kingston. She's the dean of the medical school at Queen's, and I've spoken with her a couple times about her very definite ideas. Even though the Ford government, and in fact, because the Ford government hasn't been doing very much, the city of Kingston put up $1 million to help with recruiting physicians in Kingston. Jane Philpott's ideas about primary care, health teams, and health homes is being implemented in Kingston, despite the Ford government not really doing anything yet. So I think one of my jobs is going to be, as I work for my constituents, is going to be to put pressure on the Ford government to listen, not only listen to Dr. Jane Philpott's ideas, but to put resources behind it and do it as soon as possible. We don't need to wait until the next election. the people of Kingston, the islands, the people of Ontario shouldn't have to wait until the next election. The ideas are there. How much it's going to cost, it's right there. We could start today. In fact, it's already started in Kingston.
Well, and let's just say, and the city of Kingston shouldn't be bearing the cost. This is a cost that the provincial government should bear, not the town of Kingston. I think we have time for one more. No? Yeah, hey, hi, welcome.
Hi, we published a poll over the weekend on the idea to do a tunnel expressway under the 401. The upshot is it's quite unpopular. A majority of the province opposes it strongly, and even people in the PC space seem to, a good chunk of the base seems to oppose the idea. What do you make of that?
I think the people who have responded to your poll are quite accurate. When I first heard this, I had to scratch my head and think, no, it's not April, so it's not an April Fool's joke. But the thought of spending hundreds of billions, not hundreds of millions, hundreds of billions of dollars when this province is so severely in debt right now, put this burden on the taxpayer further for a tunnel that wouldn't be built for decades. And my goodness, we can't have a date for the opening of the Eglinton Crosstown, which is over time and over budget. How could we trust the Premier to undertake such an infrastructure project? He hasn't delivered on any of the infrastructure projects that he's started. What's the progress on the Crosstown LRT? Where's the Hamilton LRT? Where's the Mississauga loop to the LRT? Where's all-day two-way GO train service on Milton or the Niagara line? What about the London GO? What about the other roads that have been committed? There's been no progress on public transit, and now we're undertaking a tunnel when we have existing infrastructure that we could leverage that's running parallel and underused. So underused, in fact, that a plane has landed on the 407. Let's utilize what we have before we build fantasy tunnels. Anyone else want to comment on this?
All I think is,
Come on over.
Sorry, whenever I hear tunnel, I just think of one thing. The Simpson episode on monorail. So all I can imagine is Doug Ford in the costume with the hat telling us all the wonderful things that are going to happen because of his tunnel. Right. And as I said earlier, he's already digging deep enough holes for healthcare here in this province. He doesn't need to dig anymore.
Let me just put closure on this. It's just another gimmick and another distraction for people to talk about that new shiny object, which this one's underground. Booze, bike lanes, tunnels, when we really need to be focused on the priorities of Ontarians, the fact that 2.5 million of them, soon to be 4.4 million, don't have access to a family doctor or primary health care. Let's distract them with shiny objects and tunnels and gimmicks, check gimmicks, and booze at the corner store, so they're not thinking about where they hurt the most and that they can't make their paycheck stretch far enough to put food on the table for the entire week for their kids and their families. And their kids are going to overcrowded classrooms. And if they want treatment, well, gosh, 11,000 people died waiting for it last year.
Last question. Back to the home care supplies. Sylvie Jones has said that she's directed Ontario Health at Home to do whatever it takes to solve this situation. But this is they've all moved to one supplier, Bayshore. Is that the weakness here? Can they make this system work with just one centralized supplier for the whole?
Well, if they start introducing more suppliers, it kind of defeats the point of their legislation and proves the point that their legislation was ill-conceived and the wrong thing to do. Listen, the system for home care that we had before certainly was not perfect. It certainly required improvement. But to throw the baby out with the bathwater, really without a plan, essentially all they had was a marketing package that would be called Ontario Health at Home. That's all they were able to deliver. And it is so on brand for this government to tear things down, talk about ideas, and have no clue how to implement them, even license plates.
You want to go? I just. So once again, we have a monopoly. Therm, Staples. You can argue the Greenbelt because there's just a select few. So it's insiders and friends. Does it make sense to have one company for the whole of Ontario Look at the size of this province. Look at the population of this province, how it's spread out. How does it make any sense? Like, I wish someone on the other end could explain, and now, they're saying we should be doing everything possible. Well, that's what you have to be doing in the first place. So it's just all performative. It's an act, right? They made a big mistake. They took their eye off the ball, and now people are suffering, and it's wrong.
Yep. Just last comment, too. It's more of the same, as John has said. And, I always wonder when they make these announcements, who's really benefiting? Because we know that it's all about rich friends, buddies, insiders benefiting from these deals. Who's really behind these deals? We saw the $8 billion Greenbelt scandal. Who's benefiting from that? Therma Spa, a foreign company, benefiting $2 billion of your money. We saw Staples, Walmart, corner stores, big grocery stores. It's always about rich friends and insiders. Who's benefiting from this deal? Every time the government stands up and makes an announcement, I'm wondering, who's it going to benefit this time? Because you know who it's not benefiting? The people of Ontario, the taxpayers of Ontario, the families in Ontario, or the farmers in Ontario. That's who we're worried about, not rich friends and cozy insiders. Thanks for coming today.